How to make your hair grow. Hair loss can be embarrassing, depressing, frustrating, but you're not alone. Sorry, wrong picture. Okay, there we go. Anyway, before you go buy the first hair loss product you see, take a few minutes to learn more. Step 1. Diagnosis. There are many forms of alopecia, with androgenetic alopecia being the most common among men and women. Treatment depends on the type of hair loss. Misdiagnosis wastes time and money, so find a board-certified dermatologist. Dermatologists will diagnose androgenetic alopecia based on a characteristic pattern of thinning and hereditary hair loss. Step 2. Get checked. If your hair loss isn't genetic, it could be a symptom of a health problem. Be ready to talk about stress, diet, drug use, vaccinations, physical trauma, allergies, any irritation or pain in the scalp, known birth defects, and a complete health history with your doctor. Step 3. Drug treatment. If your hair loss is genetic, there are 2 FDA-approved drug treatments. Propecia, or finasteride, is taken in pill form and has proven to stop the progression of hair loss in 86% of men and actually increased hair growth in 65%. Rogaine, or minoxidil, is a topical treatment that can take weeks to start working, but it's a good alternative for those who don't respond well to Propecia. Whichever drug you choose, remember, the hair growth only lasts as long as you're taking the medication. Step 4. Hair restoration surgery. Surgery offers a permanent solution of sorts, but it comes at a price. Plastic surgeon Dr. Stephen Fallick has performed hundreds of hair restoration surgeries.
Usually it involves taking hair from the posterior part of the scalp and transferring the hair, usually in small 1 or 2 micrographs, to the front of the hair to replace balding skin.
The process is mostly painless, but it doesn't always produce natural-looking hair.
One of the major concerns of hair transplant surgery is the patients that have that cobblestone or old transplant look where it looks like those hairs are either glued or stuck on. With today's technique, the hair transplant should look almost real, and by going to an appropriate hair transplant surgeon, they can give you the look that you want.
The hair restoration field isn't regulated, so be sure to ask for referrals and before and after pictures of prior surgeries. Step 5. Women and hair loss. 40% of people who lose their hair are women. Diagnosis in women isn't as easy to pinpoint. Lots of drugs are prescribed to regrow hair on female heads, but only Rogaine is approved for that purpose by the FDA. Step 6. Educate yourself. Educate yourself about alopecia at the American Hair Loss Association website at www.americanhairloss.org. Done.